connection. Educate. Celebrate. Connect. Arizona Hispanic Connection. Welcome to AARP, Arizona Hispanic Connection, for another very important show. We're going to address an important topic today. The topic is health insurance navigating your plan. Health insurance navigating your plan. And I'm going to ask if you are on Facebook, join our page, follow our page. This is very, very important to us. We will really appreciate it. We have launched the Facebook Live. It's already on, and we trust that both the video and the audio are working fine. Again, the subject today, health insurance, navigating your plan. And with us today is Andrea Parra. She is our special guest today. She works for the Area Agencies on Aging, Region 1. It's important to say Region 1 because there are, 8 regions, Andrea?
There is 8 in the state of Arizona.
In the state of Arizona, we have 8 regions. And she is a volunteer supervisor and also a SHIP Medicare counselor. That means she counsels people who have questions with Medicare. Today we're going to talk about health insurance navigating your plan. So Andrea, first of all, thank you very much for making time and to join our show today.
Thank you for having me.
All right. Again, if you are on Facebook, please join our page and follow our page and share these videos. These are very informative topics. We are addressing topics in English on Thursdays and in Spanish on Tuesdays. And every show we do Facebook Live on AARP, Arizona Hispanic Connection. So let's get to the subject. I have a ton of questions for Andrea today, and I believe you will get a lot of good information when it comes to health insurance. It's a never-ending topic. It's a never-ending debate, actually. I believe we all value our health the most, and having access to care is vital. Every country in the world has to deal with healthcare for its citizens. In the United States, the debate over healthcare never stops. The topic today is health insurance navigating your plan. And again, joining us as our issue expert today is Andrea Parra from the Area Agencies on Aging Region 1. Let me start, Andrea, with one question. I have many, but first let me ask you, based on the thousands of calls your agency receives, is there still room for learning to navigate health insurance?
There's always room. Health insurance is a very complicated topic. I feel Medicare is a little bit more complicated just because there are tons of options, not only for the different types of plans, but every county could have different types of plans. Therefore, every state as well has different health insurance plans. But yes, there's always room to learn about how health insurance works. And again, because there's so many different types, each type works a certain way. So we need to educate ourselves on each way.
Do you sense that the community, with the type of calls that your agency receives, are they still unclear? Do you find that it's getting better, or we're still we still have lots of room, lots of progress to make in our understanding of how health insurance works?
Yes, and again, there's a lot of options, but they are always changing. Every year, something might change, and maybe not your specific plan, but maybe a certain law change that makes us as consumers needing to educate ourselves on those changes, whether it's a law change, whether it's a change in my specific health insurance plan or my drug plan or my supplement. So yes, we're constantly having to learn.
So due to these changes, that makes it even more necessary to stay up to date with our understanding of health insurance.
Correct.
If I'm getting it right, that's what I perceive you are saying. Thank you. Let me ask you, the way we're going to address this subject today, health insurance, navigating your plan, is I'm going to ask a series of questions, and then I'm going to ask you to answer, and then obviously there will be a conversation between you and I. So here it is. When people are getting close to the Medicare age, which is 65 it's 65. I mean, there are other instances when people can get Medicare if there is a disability involved, but technically speaking, it's 65. So when people are becoming Medicare eligible, Medicare age, they come from different scenarios, right? They come from different scenarios. So we're going to, first of all, talk about those scenarios so that people kind of place themselves in one of these scenarios so they know what they need to do when they reach Medicare age. So the first scenario is that many will come to Medicare from what is called group insurance. That means they are still working and they have coverage from their employer, right? So can you tell us a little bit about what these folks, and I have to believe that this is, I would say, the most folks that come to Medicare will come from having a job and insurance. So what do these folks need to be mindful, be aware of when they're reaching 65?
So when we get a call from someone who is actively working, and I say actively because they have to be employed by a company, they have to be working, and then be not only working but be covered through that job, have health insurance through that employment. So when we get those types of calls, the first thing that we ask them is that we want to ask if they even plan on retiring, because that will drive the conversation. So if these individuals do not plan to retire at age 65, they plan to continue working till they can, till 70 or 66 or 67, then we tell them that they do not need to sign up for Medicare. That's one of the exceptions. And yesterday we had our first volunteer training. The SHIP program, there's about 10 staff, but the rest of the counselors are volunteers. So we had our new training for new volunteers yesterday. And I was telling one of the volunteers that back to all the scenarios, that we don't get the same call twice. But one of the most common ones is this one, with someone who is working and has insurance through their job. So if these individuals do not want to retire, they do not need to sign up for Medicare.
So technically, Medicare forces you, quote unquote, to sign up for Medicare at 65. If not, there is a penalty involved, both in money and in terms of when you can will be allowed to enroll if you violate this period. But you're saying that if someone is working and they have a job, coverage through their job, that's called group insurance, that they do not necessarily have to worry about enrolling on Medicare.
Correct. They could delay enrolling into Medicare and nothing will be affected. They will not be penalized. And again, that's the worry. A lot of people come and say, well, I've heard about penalties. I'm going to be penalized monetarily if I don't sign up, so I need to sign up. And we say, most of the times that is true, but there are exceptions. And if, again, you're covered through a group health insurance plan through active employment, that is one exception. You do not need to sign up for Medicare, and you will not, the government will not penalizing for delaying your enrollment and signing up late, as long as you have coverage all of that time through
Right.
your employer.
And we have to go on our first break, Andrea, but let me just ask you, do they have to even worry about asking if the insurance counts that coverage? In other words, that the insurance expects them to sign up or not? Do they have to worry about asking anybody in HR, for example?
If the employer, if they're working for a larger employer, most of the times that insurance is called creditable insurance. But we tell them, get some type of paperwork from your employer that proves that this insurance is creditable as it relates to Medicare. That way you have peace of mind that it is creditable, and you could delay enrolling into Medicare.
Thank you. We have to go on our short break. Stay with us. This is AARP, Arizona Hispanic Connection. We'll be right back.
Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection. The subject today, health insurance, navigating your plan. And again, I'm going to ask you, if you do Facebook, please share or follow our page and share it with others. This is very, very important to us, because we really need to know who is benefiting from these subjects. We don't want to just be serving a food, quote unquote, that nobody's eating. We really want to make sure that somebody's out there. This is radio. We don't see you, but if you join our page, we will definitely know that you're out there, and you can feel free to ask questions even through Facebook, and we will we will answer your question or find the answer. So now we let's move to another scenario, Andrea. We are talking about navigating your plan, focusing on Medicare, but obviously it touches other types of health insurance, not just Medicare. So let's go to retirees. Some people retired before they reach 65, and the company, their employer, continued to provide them coverage. Now,
Health insurance coverage.
Yes, health insurance coverage. So what are they supposed to know when it comes to Medicare if they are retirees?
So most retirees who have insurance through their former employer, one former employer, doesn't have to be the last employer that they had, they have to sign up for Medicare, with the exception of one group, and I'll go into that in a little bit later. But all health and retiree plans want you to sign up for Medicare, Why? They don't want to be the main payer. They want Medicare
course.
to pay the bulk of your health care, and then they will pick up the balance. And not completely. Some retiree plans pick up the entire balance, some don't. So you need to make sure and contact your retiree plan to see how it works in conjunction with Medicare. But those individuals who have retiree health insurance should sign up for Medicare, again, to avoid any penalties. Retiree insurance coverage is not considered creditable.
Creditable, not credible, but
Creditable.
creditable. Okay.
So the first topic that we discuss, employer group health insurance coverage, most of those is creditable, but not retiree coverage.
I don't remember that. I don't know if we mentioned COBRA. How about COBRA? Some people stop working and then the employer gives them insurance for 18 months or so. That's called COBRA. What are those folks need to be mindful of?
The same rule
Okay.
applies as retiree insurance.
right.
It's not creditable. So after a certain amount of time of you losing your group health insurance coverage through active employment, you need to sign up for Medicare. I believe it's 8 months. So after
Okay.
you lose your creditable group health insurance coverage, you need to sign up for Medicare. You could go on COBRA as well, but also sign up for Medicare no later than 8 months after you lose your group health insurance coverage, because again, COBRA is not creditable.
But because there are other deadlines, especially Medigap, I mean, I don't know if you agree with this, but I think I recommend folks to do it immediately. It is better to not miss other deadlines regarding with Part D
Correct.
and then Medigap.
Correct.
I think
So
that's important.
It's very important. I'm glad you brought that up. So you have 8 months to sign up for Medicare A and B, but only 2 months to sign up for your drug plan if that's what you want.
Right.
So I normally tell people, if you need COBRA because you're in a specific type of treatment that you need the care, definitely do that. And if you could afford it, COBRA
Right.
is very, very expensive.
Right.
So there's only a small amount of individuals who will even elect to join COBRA. Sign up for Medicare within the 2 months
Okay.
to avoid any penalties whatsoever.
Perfect. So we've covered group insurance of folks that are working, still working, and they decide to continue to work past 65. They do not have to sign up necessarily if they don't want to. And then we also cover those that are called retiree coverage. So in other words, they already left the employer, but they kept insurance. Those they have to. But then, Andrea, you said that there's
exception.
one exception. Please cover that.
The exception is federal employees. So the most common that I've gotten is people who worked for the post office. So
Okay.
you are a federal employee and are eligible for federal employee health benefits. The acronym for that is FEHB. You do not need to sign up for Medicare. So Medicare, there's a lot of rules, but a lot of exceptions.
Okay.
So this is another exception. So if you retired, let's just say at 52, and you work for the federal government and you had FEHB coverage, when you become Medicare eligible at age 65, you do not need to sign up for Medicare. But again, if you sign up for it in the future, for whatever reason you need to, maybe FEHB didn't cover something, you will be penalized because all the insurances, with the exception of employer group health insurance coverage, all the insurances that we're going to cover in a bit are not creditable. The
Okay.
only one is through active employment. So
Interesting.
COBRA, retiree, including FEHB, even though they don't require
In
you
other
to
words,
sign up
they
for
will
Medicare.
not prevent you from being penalized.
Correct.
And-
If you sign up in the future.
Late, so to
Later,
speak.
exactly.
Okay. Now, so are you saying that every plan, every federal healthcare plan, they don't have to, or are there several, and then maybe just a few that don't and some do? Because I thought I heard that there's only one within all that group that for which you do not have to.
I'm not sure. Those
Okay.
questions we refer to, they call it OPM, the Office of Personnel Management, to ask those questions. I am aware that there's two types of health insurances with them, one that works with Medicare A and B and one without.
So I would say that if anybody has a federal job, they should either call your agency
HR, if you're actively
or HR,
working.
even better, at their job, and ask them if their plan will still require them to sign up for Medicare. I believe most of them still do. I believe it's only a few, or if maybe just one of those federal insurance plans that don't. But again, this is one thing that you have to ask HR at your federal job to make sure that that's clear to you. But if you have questions, obviously call the area agencies on aging. Okay, so let's go to another group, Andrea. And we know that the famous Obamacare, right? We call it the marketplace. So some people come to Medicare, they're still working, they have insurance, that's one group. Then those that are retirees, and then there's the exception of those that have a federal job. But then there's many, I would say, also come to Medicare from the marketplace. That means they didn't have insurance through their work, they needed insurance, they went to the marketplace, so-called Obamacare, they bought a plan, and now they're reaching 65. What are they supposed to do, those that have an Obamacare quote-unquote plan?
So the majority of these individuals, it's best, the same rule applies. Marketplace is not considered creditable.
Okay.
So if they sign up late, they will be penalized. So the majority of our clients should sign up for Medicare A and B. There might be an exception, not necessarily in signing up, but in dropping their marketplace plan. So for example, if you have a marketplace plan and are receiving premium tax credits, so the government is helping
Right.
you with your premiums. A lot of individuals say it's very inexpensive, I could afford this, why do I need to sign up for Medicare if it's $135.50, which is way more than what I'm paying currently. The issue with not signing up for Medicare, again, I covered it a little while ago, is that you're going to be penalized if you don't sign up for it in time.
Right.
First issue. These individuals, it really depends. They need to call us so we could ask certain questions to see if it's recommended that they sign up for a specific Medicare plan. But what I do want to mention is that as soon as you sign up for Part A of Medicare, you are not entitled to those premium tax subsidies for your
Okay.
marketplace plan.
Okay.
So the cost will eventually go up as soon as you sign up. That's one thing. The other thing, some individuals who are on a marketplace plan, and if they're really, really sick, they might have already met their maximum out-of-pocket plan for their Advantage plan, and that might be a reason why they don't want to sign up.
Are they allowed? So they have choices? It's not like if I have a marketplace plan, I hit 65, I have to drop it and go and sign up for Medicare.
They could keep it till the end of the year.
Okay.
And then when they need to re-sign up, healthcare.gov that's one of the questions when they're renewing it that they'll ask, are you eligible for Medicare? And at that point,
they won't allow them to proceed.
correct, exactly.
Okay.
At that point, they will say yes, and they will not be able to continue the application.
Could we say that as a general rule, anybody who has a marketplace plan should, at the very least, call your agency or be informed? But in most cases, it might be better to enroll on Medicare, or at the very least know the options.
Correct. Definitely contact us. But yes, you definitely have to sign up. There are guidelines to sign up for Medicare, but for sure sign up to avoid any late enrollment penalties. But the question will be now, do I drop my marketplace plan now or let it run till the end of the year? And that's when they should call us. It really depends on their health.
So basically, yes, sign up, but there's an option that you might be able to keep your marketplace until the end of the year.
Without the subsidies.
Right.
But at least they'll be able to continue covering you till the end of the year.
Got it. This is very, very important. I think many people will come from the marketplace as well. We are going to go on another break. Stay with us. We are addressing today health insurance, navigating your plan. This is AARP Arizona Hispanic Connection. We'll be right back.
Celebrate. Connect. Arizona Hispanic Connection.
Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection. Very important subject today, health insurance, navigating your plan. I use navigating quite a bit on my shows because I shouldn't say quite a bit, but I've used it several times because I like this word and I think it's very appropriate. Navigating. We have to navigate our health insurance. It's not that simple. And today we're just basically addressing something very basic. In other words, when you reach 65, you will come to Medicare from different scenarios. So we're just trying to address those scenarios. We're not even necessarily explaining the ins and outs of how insurance works, but we'll do that later on. So let's go back just to let you know once again. Andrea Parra is our guest today. She works for the Area Agencies on Aging. She is a volunteer supervisor and she's also a Medicare counselor for the SHIP program. Very important program. Andrea, let's talk about folks that come to Medicare to age 65 and they are veterans. They have services available to them through the Veterans Affairs or Administration.
So if an individual is receiving their health insurance coverage through the VA, again, VA is not considered creditable. They should sign up to avoid late enrollment penalty. So again, the same rule applies for VA for veterans. There is no coordination of benefits between the two programs. So and that would be our recommendation for a veteran who is receiving services from the VA. We're going to recommend that they do sign up for Medicare because if for some reason something happens and the VA doesn't cover a specific procedure that they need, a medication, and Medicare might, if they don't sign up for Medicare in their initial enrollment period,
the penalty.
They'll come the penalty, and then they won't have Medicare if they didn't sign up.
No, just so I understand, are you saying that a veteran potentially could have care apart from Medicare and be okay?
Yes.
Okay, so they have hospital care, doctors, and prescription drugs too?
Correct.
So that
everything
the
through
only
the VA.
issue, through the VA. So the only issue here is that if they ever want to join Medicare, they're going to be hit with a penalty.
True, and if they ever need care outside of the VA,
they
will not have coverage.
That is important.
So
okay,
we
because VA
always
care is always done in VA facilities.
Exactly.
Got it.
So we recommend to our veterans to get both. Yes, they will pay an extra premium, and that's their main concern. Why am I paying $135.50, which is the Medicare Part B premium for 2019, when I'm not getting my care outside of the VA? I'm going to the VA. Most of the times it's free. They're not paying anything. Why am I paying an extra premium for an insurance that I might not even need or use because I don't go outside of the VA?
Do you think that's something that veterans understand clearly, or they don't? So you get some calls and
we get a lot of calls.
You can tell that they're not clear, and they ask, I already serve my country. I have service through the government. Why do I have to pay more to get more services?
And again, they don't have to. So they don't have to join Medicare, but we recommend that they do to have what I call a backup insurance.
Right.
Again, there's no coordination of benefits. So it's not like you will go to the doctor or get a service, the VA will cover first and then Medicare will cover second. No, they're completely independent. So if you have VA coverage, go to the VA to receive those services. If you need to go to a doctor outside of the VA, then use your Medicare, whatever option, whatever plan you choose.
Got it.
And then use that plan. So
very important,
both.
of course. Let's go to folks who come to Medicare at 65 with no insurance. They were not covered. They hit 65. What do they do?
Again, they should sign up to avoid penalties.
Right.
Everything is related to not signing up on time and being penalized. And obviously, if someone's really, really sick, this is their opportunity to have health insurance. They will have doctor coverage. They will have medication coverage and so forth that they need if they're sick.
So let's be clear. Whereas Social Security people can solicit or apply for benefits at 62, and then after 62 they can do it whenever they want. Literally, they can do it whenever they want. Not so with Medicare. Medicare is very strict in that everyone has to sign. Well, that the age to sign up is 65, and the problem with not meeting that deadline is penalty in terms of money. I believe they charge you I think 1% for every.
That's for Part D.
For Part D is 1%
per month
that you
did not.
delay, and then for Part B it's
as in boy,
10% for
every year.
For 12-month period.
Correct.
I remember that.
Yes.
I remember it. So there is a penalty, and in addition to that, you will not be allowed to sign up whenever you want. You're going to have to wait until the beginning of the year. I think it's January through March
31st. So
And then-
we're in the general enrollment period now.
That's called general enrollment. So you get penalized with money, and then with the time that you're allowed to
Sign
enroll.
up. And then the third thing is, if you sign up during the general enrollment period, there will be a delay in coverage. Your coverage will not start until July 1st.
July. Wow, that is very
so
important.
three things that you want to avoid.
Right. Okay, so let's talk about another point that is very important. Sometimes people reach 65 and they haven't worked enough, because people need to understand that for Part A, which most folks do not pay a premium, because we worked at least 10 years and pay our FICA tax and we have our 40 credits. We come to Medicare, no problem. But then sometimes people come to Medicare and they haven't worked enough. What happens with them?
So usually this population are immigrants.
Okay.
They came here at a later age and they worked, but they don't have the 40 work credits. They didn't work the full 10 years to qualify for the premium-free Part A.
Got it.
These individuals, when they become Medicare eligible, Part A again will not be premium-free. If they don't have any work history whatsoever, any credits, their premium will be around $420, $430 per month.
That is extremely high.
Per month.
And let's make this clear. So Part A covers hospital care.
Inpatient hospitalization, hospice, other things, but it's mainly known for their inpatient hospitalization.
So now, can somebody sign up for Part B and D and not for A?
Correct. So
Okay.
these individuals who, again, do not have the 40 work credits, our recommendation will be to at least have some coverage.
Right.
Sign up for B and D. B will be the $135.50 per month, and B as in boy, and D as in David. It really depends on which plan. There's about
25,
$30. But on average, the premium is $35.
So roughly $150, roughly a little bit more, but they'll have coverage for doctors Part B, medications Part D, but no hospital insurance.
No hospitalization, no hospice care.
Okay, now how about if that person has a very low income? I understand there's something called, is it conditional?
Yes.
Can you explain that, because I think it's very, very important.
So the individuals who don't have the 40 work credits, most of the time don't have high income. Maybe they're receiving supplemental security income, maybe they're not, but their income is not very high. If these individuals qualify for Access Health Insurance, and we'll cover that next, they will qualify for the state to pay their Part A premium. So these individuals, we would refer to Social Security to sign up for conditional Part A.
This is very important.
And by them applying for conditional Part A, they're telling Social Security, look, I cannot afford $430-something per month to
Right.
have Part A, but I'm currently approved for Access, and Access will pay my premium. So I'm applying for conditional Part A. I only want you to give me Part A under the condition that the state of Arizona or your Medicaid program with Medicaid
California
program,
is Medi-Cal.
yes, in California they call it Medi-Cal, Arizona we call it Access. So under the condition that Access pays for my Part A premium. So, but only in that instance, only when they're considered low income,
Right.
would we refer to Social Security to apply for conditional Part A.
And just roughly, I mean, the federal poverty level, we're talking about a little over $1,000 for one person,
Yes,
roughly.
1,041 is the guideline.
And for couples?
I do not
think
have
it's something
that
like
number.
1,300, I
Yes.
believe.
Mhm.
But again, you have to qualify based on income for access for Medicaid, and then sign up for Medicare and it's called conditional Part A.
Conditional
So
Part
the
A,
Social Security will have to approve that, and if they do, they'll actually pay.
Well, the state,
The state.
both entities have to approve it. So
Right.
Social Security would approve the conditional Part A once the state agrees to pay the Part A premium.
So so anybody who doesn't have the 40 credit is not all. In other words, there's hope.
There's
There
hope.
are options. Now, here's a very important one. What happens when somebody's has Medicaid, which is access in Arizona, and they are reaching 65? What's going to happen with that group?
It really depends, and it depends on their income. And this is probably one of the most complicated questions or types of clients that our office gets. The main thing that we need to understand is that access, there's different ways of qualifying for access. There's not just one program to be eligible for access services.
Okay.
There's different ways to get approved. What happens when someone becomes Medicare eligible is that the guidelines simply change because it's a totally different program. So the services are the same. The goal is to have an access
let
health
me see
plan.
if I understand that, because this is very important. For instance, in Arizona, we had the Medicaid expansion. So instead of 100% of federal poverty level, people could get access now under 138. So now
Correct.
it went from 100 to 138% of federal poverty level. Are you saying that when people hit 65, they go back to the 100%?
Yes, that's
That is
the
crazy.
main difference, and the main reason why people who are currently on access, when they become Medicare eligible, they lose their access coverage, not because their income increased, not because something else that they did change. It's just that the guideline changed on them. It went from
Wow.
138% of the federal poverty level to 100%. So Access is evaluating these types of people. They receive notification, this member is turning 65 come April 1st. We need to, instead of assessing their eligibility using the 138% federal poverty level, now we need to apply the 100% because that's their guideline for that age.
So am I getting this? So before Medicare, it was part of the Obamacare, so-called Medicare expansion.
Correct,
And now at
138%.
65, they go back to
100%.
which is that the Medicare Savings Program?
No. Well, yes and no. There's different Medicare savings program, but the one that offers the most benefits, yes, it's called QMB. That's at 100% of the federal poverty
So
level.
they go back to the 100%.
Correct.
Basically, that's the concept. We have to go on our last break. We are explaining what happens to people when they reach 65 from the different scenarios: group insurance, retiree insurance, if they have the credits, if they are veterans, and so if they had a marketplace plan, etc. Stay with us. We will have our last segment coming up in just a few seconds. Again, this is AARP Arizona Hispanic Connection. We'll be right back.
Celebrate. Connect. Arizona Hispanic Connection.
Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection. I guess I'll fail if I don't mention this again, but I just feel so good when we address issues such as this one. I think there's just a lot of, I would say, need of this type of information. A lot of people, we're busy. We work and we go out, out and work and come back tired, and sometimes we just don't have the time, and we end up worrying about health insurance when we need it, when we get sick, and I think it's kind of understandable in a certain sense. It's typical. Sometimes we don't worry about things that until we need them. But anyway, it is so gratifying to be addressing these important subjects. And we do this again on Tuesdays in Spanish, on Thursdays in English, and everything goes through Facebook Live. And then the shows become videos. The videos stay on our Facebook page if anybody wants to continue or to go back to any of the shows. And I really want to ask you to please follow our page and then share it. This is very important. We are getting close to 1,700 followers. We would love to be between 3,000 and 5,000 followers. That's our next goal. So please help us reach that goal. Let's, we just have a few more minutes, and we have more scenarios of what happens with people when they reach 65 and it's time for them to consider signing up for Medicare. Just before we go to another group, Andrea, what happens, because some people get their Medicare card automatically, where others do not. Can you explain that scenario?
Yes, the difference is receiving Social Security benefits, whether it's disability or retirement benefits. So if an individual is already receiving Social Security retirement benefits before age 65, so let's just say they decide to retire early at 62,
Okay.
those individuals do not need to sign up for Medicare Part A and B with Social Security. They will automatically receive their Medicare card 3 months before their 65th birthday. So if you're not receiving Social Security retirement benefits, you have to sign up with the Social Security Administration. You will not be automatically signed up for A and B.
My phone number is all over the place, and I get calls, a lot of calls, and some people get kind of confused because they never sign up for Medicare, and all of a sudden they get something on the mail, and there is their Medicare card. So they say, what do I do? So we explain to them exactly what you just said, that if they're receiving Social Security benefits already, Social Security already knows about that, and they take the initiative and sign you up. Now, but I think it's something that is very important is that they need to understand that the enrollment is not complete because it only comes with A and B,
Correct.
not D, which is prescription drugs. And then they have options that they will not know unless they go with somebody who can help them. Obviously, sales agents are a valid, very valid option. Then you have the Area Agencies on Aging, which is a non-profit, unbiased agency that helps people. So the recommendation would be that when somebody is receiving Social Security and all of a sudden they get the Medicare card, they need to contact the agency to make sure, because in some instances, if they don't want to sign up, they can return that card, correct?
Correct. Yes, they could delay enrolling into Medicare, but the only reason we would recommend that is if they're working and have insurance, creditable group health insurance coverage through their employer. So the main thing is if you know someone who did not sign up and they receive their Medicare card in the mail, we already know why they received it. They're receiving Social Security benefits, to know that they're not done. Something is missing. I need to take action. Who do I contact? They could contact, like you mentioned, any broker, contact an individual health insurance company and speak with the CSR, a customer service representative or a sales agent, or they could contact us, the Area Agency on Aging. We are part of the State Health Insurance Assistance Program, and we provide free, unbiased Medicare counseling.
Can you give us the number just so we don't forget at the end?
Yes, our phone number is 1-800 432-4040. Again, that's 1-800-432-4040. So if you call that number, you will have to leave a message. There is about 10,000 people a day turning 65 in the country.
Wow.
So like I mentioned earlier, in our office, there's 10 staff, 60 volunteers not there every day. So we're returning our calls in the order that they are received. So definitely call, leave a message, and we will try our very best to return calls within 48 hours, business hours.
Perfect. Now, just for those that go to the internet, I assume that they can Google. What should they Google if they want to go that route?
They could Google the Area Agency on Aging.
Okay.
We have a lot of information on our website.
So they just
it's
go area
AAAPHX.org. So
Okay.
www.aaaphx.org, and they will get to our benefits assistance SHIP program, and they could email us there, or our phone number will be there, and they could give us a call.
So remember, Google is always an option. Just Google the Area Agencies on Aging, and you will get the number. Okay, let's cover a little bit more, because there's a group that I believe is very important to cover. My mother never went out to work. She was too busy raising 9 kids. She never contributed to the Social Security, never earned any credits. So what happens with a spouse? It could be a male or female, a spouse that does not have the credits, but has the spouse, right, that did work and that accrued at the minimum 40 credits.
So those individuals are definitely eligible for Medicare under their spouse's work history. There's other conditions that have to be met. I believe they have to be married for a certain amount of time to be eligible and things like that. But they are eligible for Medicare Part A and B, and they should sign up just like someone who does have the 40 work credits. The rules, the initial enrollment period rules still apply. So they would, if they're already receiving Social Security benefits, spousal benefits, they will automatically get their Medicare card in the mail, contact us, and we will help them through the enrollment process. If they're not, go to Social Security and sign up, and then contact us.
Now, for Social Security, when a spouse is going to solicit or apply for Social Security benefits based on the record of his or her spouse, that spouse has to be claiming benefits first before the spouse can be granted benefits. Is that the case on Medicare, or not? Is not the case if somebody is going to apply for Medicare when the spouse that has the credit is younger?
I believe they have to sign up at 65.
Okay.
They're really strict on the rule,
Right.
unless they have creditable health insurance. Maybe the husband or the spouse is working and has insurance through that job. Maybe the spouse, it's best that they go onto the insurance from the spouse, from their job.
Got it. So for the most part, people who are going to be applying for Medicare based on the spouse's work record, most likely they will be allowed to sign up. Not so, I repeat, on Social Security. With Social Security, they will not give benefits to a person who is applying based on somebody else's credits until that other person, the spouse who has the credits, applies
signed up
first.
Yes.
Okay. Now, let's end the show talking about people who have access, because this is another, I believe, out of 7 million people in Arizona, 1.8 getting close to 1.9 million people have access. So many people will come to Medicare having an access plan. What happens with those folks?
So we did cover it a little bit a while ago. The main issue is that the income eligibility guideline is different. It goes down from 138% of the federal poverty level to 100%. So if you are one of those individuals who are caught in the middle, most likely you will lose your access benefits, which is a big deal. That is probably one of the biggest complaints that we get from callers is,
Right.
I didn't do anything. Now because I'm older, you're taking away my health insurance. And we have to explain, it's not that we're taking away, it's just now that you're eligible for a brand new benefit, meaning you're eligible now for Medicare and you're entitled to Medicare, and now they will be taking over and you will be getting your health insurance coverage through Medicare, not Access.
So one aspect would be that they potentially might lose access, but on another angle, the fact of the matter is that they have to sign up, correct?
Yes. Again, Access is not considered creditable, and we get that question a lot. Well, I'm not going to sign up for Medicare. I'll just stay on my Access.
You cannot.
You cannot, because again, the Medicare rules are it's not creditable. If you delay enrolling, you will be penalized and so forth. And then also Access, they know when you turn 65.
Right.
So they will want you or need you to apply for Medicare because again, just like a retiree plan, they don't want to pay 100% of your cost if you're entitled to another benefit like Medicare.
Right. Perfect. So bottom line, anybody who has an Access plan, most likely they're going to have to sign up. And let's explain that Medicare and Medicaid are two different programs.
Correct.
The folks that have an Access plan, Access is Medicaid in Arizona. When they reach 65, they have to literally switch to the program of Medicare. But then if they have a lower income, if they meet the income requirement, they will have both.
Exactly. So if I talked about those caught in the middle losing Access benefits, a lot of them will continue with Access because their income is still under 100% of the federal poverty level. So those individuals will be eligible for both Medicare and Access, and we call those beneficiaries full dual beneficiaries because they're eligible for both. And if they are, both programs will provide the health insurance coverage that they need, and it'll be pretty much 100% coverage, meaning the beneficiary will not have to pay any co-pays, any deductibles, premiums, and so forth.
So basically, they will have Medicare
as
and
primary.
Medicaid, obviously in Arizona, being Access, Medi-Cal in California. They will have both, and they will be very, very well covered.
Correct. They will have the most benefits. They'll be eligible for specific plans that offer dental, vision, and hearing coverage, which most Medicare plans, specifically original Medicare, does not cover.
Yeah. Thank you, Andrea Parra with the Area Agencies on Aging. We had an outline of more points. We only cover actually one. So thank you. We'll ask you back to come back and share with us more information on this important subject. Again, if you are on Facebook, please follow our page at AARP Arizona Hispanic Connection and join us Tuesdays again in Spanish, Thursdays in English. We will be back with another important subject. Thank you for joining today. Have a great rest of the day.
La 1190 AM es más que una estación de radio, es también una plataforma.